All right, I'm Dr. William Stiles. I'm a board-certified urologist and men's health expert, talking to you today about prostate cancer. And if you've watched this video, you may have been recently diagnosed with prostate cancer. And our goal is to talk about the early part of prostate cancer, the early stages. In the early stages, obviously you get your diagnosis from your biopsy that was done at your urologist's office. And you're going to look at that biopsy report. And there's a lot of important information in that biopsy report. You want to know your type of prostate cancer. There are many different types and subtypes of prostate cancer that all can play a part in what you do for that prostate cancer. So that's one of the first things you'll want to do, is understand specifically what type of prostate cancer you have. The next thing is the volume of cancer. How much cancer was there? How much tissue was benign and how much tissue was cancerous will give you an overall idea of the size and the amount of cancer that's present. Again, it's an estimation because oftentimes it's done with a random ultrasound biopsy. It does give you an idea of the volume of cancer. The next thing is, did you have random biopsy or did you have MRI guided biopsy? These are different technologies and different results come from these two tests. So it's important to know which one of these you had at your urologist's office. Now, there are what are called predictive nomograms for prostate cancer. These are tools that you plug in your PSA, your biopsy result, your x-ray result, and your clinical stage, and you actually get data on the outside based on previous pathological specimens. You actually get an idea of what percentage you are localized, what percentage you are locally advanced, and what percentage chance you have metastatic disease based on these things that you already know, the PSA, clinical grade, biopsy result, and these x-rays. So we'll walk you through how to use these predictive nomograms, again, to get more information. This early part in prostate cancer is getting information about your cancer, about your body, and about the stage of disease. And then from there, then you can really start diving into treatment options. There are some early considerations, some things that you should consider doing when you are diagnosed with prostate cancer. We will go through some of those early considerations. And then your voiding and bowel patterns. These are things, when you do treatment for prostate cancer, it can affect any anatomical structure that is down by the prostate. So your voiding and your bowel patterns, these are things that can be affected from any treatment. So you go here, your diagnosis, learning about your cancer, and then you get what are called staging x-rays. And these are x-rays that look at the extent of cancer, or has the cancer gone from the prostate? Is it just within the prostate? Is it locally advanced, like cancer just outside of the capsule of the prostate? Or is it possibly metastatic, meaning it's spread away from the prostate to other areas like pelvic lymph nodes, bones, liver, brain, other soft tissues throughout the body? That would be called metastasis or metastatic prostate cancer. But there are 4 different types of x-rays that guys may have. Bone scan to look for bony spread of prostate cancer. CT scan is primarily to look for lymph nodes or other abnormalities in the pelvis or the abdomen. MRI, magnetic resonance imaging, is something that looks specifically at the prostate and can actually visualize most suspicious prostate lesions. And it can better characterize the lesions, give you a size of the lesion. It can show if there are additional lesions in the prostate. You know, about 40% of prostate cancer is multifocal, meaning if prostate cancer is in one place of the prostate, there's a 40% chance that it's elsewhere within the prostate. So MRI can be helpful in determining, are there other suspicious lesions in that prostate? Now, it also will show the location of these abnormal lesions in the prostate. Is it adjacent to the prostatic capsule or the covering of the prostate? Is it close to the neurovascular bundles, which are the nerves that run on the lateral side of the prostate or the outer part of the prostate? Is the cancer close to those areas? So that's important to know. So MRI has become more and more popular as far as looking at patients with prostate cancer, again, to gain more information. There's also PET scan, which is using a nuclear tracer that attaches to prostate cancer cells. And when the nuclear tracer attaches to these cells will then light up and be found on scan much easier than it would be on just a basic CT scan. PSMA is something new in the prostate cancer world, something that potentially may change how we manage men with prostate cancer. But PSMA has been found to be effective in early diagnosis of prostate cancer or earlier diagnosis of small prostate cancer lesions. It's been beneficial in looking at prognosis of prostate cancer, or how well do people do with prostate cancer. And then the last thing it can do is potentially add another treatment where prostate cancer cells are specifically targeted and agents are delivered directly into those prostate cancer cells to essentially kill the prostate cancer cells. So newer technology that's out and potentially available. It's in clinical trials right now in the United States. It is also given in Australia and Germany. But PSMA technology is something that I believe will change urology and will change the management of prostate cancer going forward. So this is the early steps, and you can tell just talking about that is a lot. We haven't even gone into much detail here, but just talking about it is a lot of information. And you take this information and now you talk about treatment options with your physician. Now, before you even get to treatment discussions, there are some important things to know. One is you can't be in a huge hurry to make a decision for prostate cancer. Yes, there are some specific situations where, yeah, you may want to make a decision quicker, especially if it's, a metastatic disease or a high-grade cancer. You wouldn't want to wait an extended period of time, but most people, because they are diagnosed with localized prostate cancer, usually you can wait 3 to 6 months to make a decision and make sure that you are getting the right prostate cancer treatment for you. But treatments range anywhere from surgery, external beam radiation. There's different types of external beam radiation. These types of radiation send photons, like X-ray energy photons, directly to the prostate and the surrounding areas and the lymph nodes. There is proton beam, which is, instead of using photons now, proton beam uses energized protons to deliver radiation to the prostate. There's internal radiation, which is brachytherapy, or seeds, radioactive seeds that are placed into the prostate. There's cryotherapy, or freezing of the prostate. There's chemotherapy, and there's not a terrible amount of traditional chemotherapies that are effective for prostate cancer. There are some that are effective, but the traditional chemotherapies are not terribly effective for prostate cancer. Immunotherapy is something that where white blood cells are harvested, they're tagged, and then they're reinfused into the body to target and treat prostate cancer. ADT, or androgen deprivation treatment. These are medications or surgery that lower the testosterone. Testosterone is essentially the fuel for prostate cancer. So if we can lower that testosterone, there's no more fuel for that prostate cancer to grow. And so androgen deprivation treatment is an effective treatment, especially for advanced prostate cancer. This ADT can also be used in patients that undergo any of these radiation treatments. One, because it can shrink the prostate over time, but it also makes the cancer more susceptible to whatever energy is being delivered to it. So no doubt you will want to know about androgen deprivation treatment. And then there's alternatives to treatment, like focal treatment or clinical trial. There's so much in prostate cancer treatment. There's lots of options. Knowing that ahead of time, I think, is important. Having a plan with how you're going to set up appointments and learn about your prostate cancer. Talk to these doctors to find out what is the best treatment for you, ultimately, is the goal. Now, again, I've developed a prostate cancer course for the newly developed prostate cancer patient that will walk you through this in a step-by-step fashion. I'm trying to make things simple and trying to make a very complex topic and a complex medical situation. We're trying to make it as simple as possible through stepwise teaching. That's the prostate cancer course. Look for it. There'll be a tab, so if you want to buy the course, you can click on that and buy the course and have it ready to review right now. But I am Dr. William Stiles. I am the prostate coach, and we're here to help. We have lots of videos that we'll be uploading not only to YouTube, but to the social media to help guys learn about prostate cancer. There's really two goals with the prostate cancer course. The first goal is to help guys prepare for their physician appointments. Those appointments are so important. The more you know and the better you're able to discuss with your physician, the better communication you'll have on both sides. That is the goal of the course, is better communication with your physician. Another goal is the big goal in all of this, and that's that you get the prostate cancer treatment that is right for you. That's important. About 40% of guys after treatment regret their treatment decision. And that can happen for a lot of different reasons. One is there's side effects of treatment, any of these treatments, and their serious side effects can potentially be life-changing. It can affect their quality of life for a long time. If you're one of those patients that has side effects or your quality of life is affected, oftentimes you can regret the treatment choice you made for prostate cancer. So that's the first one. Second thing is, if you undergo treatment for prostate cancer and your cancer still is there, and so either there's a positive margin when your surgery is removed, or the treatment you initially choose doesn't eradicate the cancer and you have to go back and have additional treatment fairly soon after your original treatment, that can be disappointing. And then the third thing is, guys oftentimes feel like they're not prepared to make that decision. They still have many questions that are left unanswered and they feel like they had to make a decision too quickly. Sometimes that can bring regret with regards to their treatment option. But with our prostate cancer course, we're trying to alleviate all of these regrets. We're trying to again, educate men on their disease, on prostate cancer in general, treatments for prostate cancer. We're also going to walk you through, after this first part of the prostate cancer, we'll also have tips and tricks and additional information that can help you on that journey with prostate cancer. So again, I'm Dr. William Stiles, the prostate cancer coach. We are here to help you with whatever part of that prostate cancer journey you're on.